Hi, dear friends. I am Dr. Rajasekhar M R. Very commonly asked question is, why does the incidence of piles during pregnancy is more? So first let us understand what are piles. Piles are nothing but bunches of blood vessels arranged in three groups inside the anal canal. Everybody has small bunches, they are called anal cushions. So they act like valves to prevent escape of air, leakage of fluid and all. So they tightly close the anal canal. So what happens is when the more blood flows into that and when they start enlarging, we call them as piles or hemorrhoids. Piles and hemorrhoids are one and the same. Because they are blood vessels, when the hard motion goes over it or lot of pressure is over it, then they can rupture and start bleeding, or they can become bigger and start popping out when a patient passes motion and goes back, or it has to be pushed back. These are different stages of piles. So piles are nothing but bunches of blood vessels which are arranged inside the anal canal. Now, what are the causes of piles is when the pressure is more inside the anal canal, either due to raised intraabdominal pressure, what we call is intraabdominal pressure is we apply more pressure on the stomach, especially if there is constipation, we'll apply more pressure while passing stools. Similarly, during pregnancy, what happens, because the child is there in the womb, there will be pressure on the abdomen and there will be congestion in the blood vessels and they start enlarging. The piles which are already there, they start enlarging and they can either bleed or they can start coming out, or sometimes blood gets clotted. So that's why the pregnancy increases the risk of piles. Now what are the symptoms? The symptoms of piles are mainly two, either bleeding while passing motion or they can become enlarged and they come out. And then how to manage them. So there are different ways of managing. If it is a mild bleeding, especially in the first trimester, first 3 months of pregnancy, it is better to avoid any surgery or even medical interventions as far as possible. We will try to avoid in the first 3 months of pregnancy. After that, there is no risk in doing if surgery is required. So if it is a very mild occasional bleeding, we can manage with certain medicines are available. They are safe even during pregnancy. So they can be used, that they will be prescribed by the gynecologist. In consultation with the gynecologist, a surgeon or a physician will advise, or a gynecologist herself can manage it with medical management. But if there is swelling which is coming out and stuck up, there was a time where people used to ask them just to manage it till your delivery is over, after a month or two we'll do surgeries. This one we don't accept it because it is too risky to have a 3rd degree, 4th degree piles which are coming out when they pass motion, a bleeding and all that. And especially during delivery, especially if it is normal delivery, lot of pressure they will be applying. That time if it starts bleeding, it causes more problems. And if it is regularly bleeding, it can cause anemia and cause problems. So there is no harm in doing surgery. The only risk or fear during the surgery is of anesthesia. So that also spinal anesthesia can be given safely, but if the anesthetist or if there are any other indications to avoid spinal anesthesia, you can do even under local anesthesia. I had a patient who came down from England to get operated here because they were not willing to operate her. She was in her 2nd trimester. Piles had come out every day. She has pushed it back. Each time she pushes back, some amount of bleeding will be there. She was worried. She came down under local anesthesia. We operated. 3 days she stayed here and flew back to London. So there is no contraindication even during pregnancy. So it can be safely operated, and medical treatment also can be given depending on the severity of the piles.